Oh, absolutely not. In fact, vaccine is immune therapy, just like interferon alpha is immune therapy. So I'm not anti-vaccine. My job is to develop immune therapies. That's what vaccines are.
Do you believe that this virus was created in a laboratory?
I wouldn't use the word created, but you can't say naturally occurring if it was by way of the laboratory. So it's very clear this virus was manipulated, this family of viruses was manipulated and studied in a laboratory where the animals were taken into the laboratory, and this is what was released, whether deliberate or not. That cannot be naturally occurring. Somebody didn't go to a market, get a bat, the virus didn't jump directly to humans. That's not how it works. That's accelerated viral evolution. If it was a natural occurrence, it would take it up to 800 years to occur. This occurred from SARS-1 within a decade. That's not naturally occurring.
And do you have any ideas of where this occurred?
Oh, yeah. I'm sure it occurred between the North Carolina laboratories, Fort Detrick, U.S. Army Research Institute of Infectious Disease, and the Wuhan laboratory.
$3.7 million flowed from the National Institutes of Health here in the U.S. to the Wuhan lab in China, the same lab where many people have said that this coronavirus infection first originated. We also now know that NIAID, the department associated with the National Institutes of Health, of which Dr. Anthony Fauci is in control, had already been conducting experiments with the Wuhan lab in the past in regard to coronavirus. If Dr. Anthony Fauci cannot be honest with the public about his connection to this lab, then Fauci has to go.
In 1999, I was working in Fort Detrick in USAMRIID there, and my job was to teach Ebola how to infect human cells without killing them. Ebola couldn't infect human cells until we took it in the laboratories and taught him.
It's hard to ignore the death tolls. People have been dying. They are dying from this in quite alarming numbers. How do you reconcile that?
It's pretty easy when you see, for me, when you see what the government has done, and that is that they took, quoting Dr. Birx,
we've taken a very liberal approach to mortality.
If my husband were to die, who has COPD, his lungs have fibrosis, his lungs would look exactly like somebody with COVID-19, theoretically, but he has no evidence of infection. So if you're not testing and you don't have evidence of infection, and if you walked in there today, they'd call it COVID-19. And we hear this from the doctors and nurses who are upset.
I've seen so many doctors online that have made their own webcam videos, just perplexed by the protocol that the CDC had given them.
Well, last Friday, I received a 7-page document that sort of told me that if I had an 86-year-old patient that had pneumonia but was never tested for COVID-19, but sometime after she came down with pneumonia, we learned that she had been exposed to her son, who had no symptoms, but later on was identified with COVID-19, that it would be appropriate to diagnose on the death certificate COVID-19.
When I'm writing up my death report, I'm being pressured to add COVID. Why is that? Why are we being pressured to add COVID? To maybe increase the numbers and make it look a little bit worse than it is? I think so.
Why would they want to skew the number of deaths due to COVID-19?
Well, fear is a great way to control people. And sometimes people's ability to think for themselves is paralyzed if they're frightened enough. And that's not where I want people to be. I want people to say, we're going to get through this. I'm going to use my head. I'm going to go to different sources. I'm going to listen to different sources. And I'm going to think for myself, because that's what America's about.
If someone dies with COVID-19, we are counting that as a COVID-19 death.
You don't die with an infection. You die from an infection.
I've talked with doctors who have admitted that they are being incentivized to list patients that are sick or have died with COVID-19.
Yeah, $13,000 from Medicare, if you call it COVID-19.
Right now, Medicare has determined that if you have a COVID-19 admission to the hospital,